that's selling the drugs in the communities, by the people that in office, in government departments, that doesn't want them to do the work that they do. They need a farm. Give them the farm, give them the access, registrate them, and help people that really wants to help people. There's a lot of people that wants to help, a lot of organizations that are not registered, but let's get them registered. Thank you.
Thank you so much. Cheryl?
Thank you so much. Is my mic on? I want to just also pick up on the IOG. I think we thank Kurt and his team for what he's doing. But IOG, yes. It's a treatment program or NPO that was started. But I think it is important, and I'm going to maybe disagree with my colleague from the Free State in saying, if we want to uphold the Act and legislation, we need to ensure that the treatment centers is registered. So it is important that we do not try to play around with it, that we engage with people, and there's a lot of people doing good, especially in Gauteng province. There's a lot of NGOs, NPOs that is doing good, that is saving our children. But I think it's time that we come together. Again, just like we say in coordinated interventions by the various departments, as NPOs and NGOs, we need to have a coordinated intervention as well and not be competitive. Because I think sometimes one NGO thinks they are better than the other one, but we are in the same space. When we take hands, when we take hands, we will get better results to kill that.
Don't save lives. People save lives.
The next, finish off.
So I'm saying the NPOs must come together and have a coordinated, like come together and have one kind of format in doing things and supporting each other. I think that is important for me. The other thing is, with regards to NPOs in communities, a lot of times people want to start because they think there's funding. It is important that we have our treatment centers registered, that we do community-based treatment programs. Again, we need to have some form of umbrella that brings the NPOs together so that we can support each other and not run each other down. I think that's what I want to say. Because if you look at treatment action campaign against HIV and AIDS, they could make a great impact because all the NPOs came together that was fighting HIV and AIDS. So I'm calling on all the NPOs that fights substance use disorders or that provides treatments to come together so that we can have a stronger voice together.
Thank you. Western Cape, my apologies. Western Cape, can I also just have one more last chair, if you can wrap up, please, just so that we can proceed with the proceedings of the day. Western Cape?
Okay, thank you so much. Okay, colleagues, Councillor, I think the question relating to the Western Cape in terms of cross-border drug trafficking, I think that should really be directed to SAPS because technically I'm from DSD and we can talk about it around the table, but in essence, if SAPS is absent, where are we going to talk with who about tackling the supply reduction? My mandate, I know my mandate, what my mandate is, but we also need SAPS representation on the table, around the table. And I know what we are doing as Western Cape government. We know where our challenges are. We're not saying we're perfect. We know that the Cape Flats has been renowned to have the gangsters. I mean, that is originally where it comes from. Gangsterism, the Cape Flats, we all know the stories about the Cape Flats. However, as the Western Cape government, we've implemented a safety plan targeting with our metro law enforcement police, with our municipalities. We basically had MOUs with Swartland, Mossel Bay, I think Overstrand, and they using the K9 units with Department of Police and Community and Safety to tackle the drug supply where SAPS is not able to reach as well, but they're working together with the SAPS locally. So that's why I say it's a coordinated approach. The fact that we as provinces also need to start talking together. I've always said that we need to start working closer together as provinces as well, the chairs, the forums, because we can learn from each other. What I've done in the Western Cape as well through my partners, the NPOs that sit here, that have been invited. It's a pity that the municipalities couldn't come because that wasn't donated. The funding didn't cover the municipalities. Then we could have had a liquor discussion now with the councillor from Gauteng here, how we are doing it in terms of capacitating our municipalities, letting them take ownership of their action plans and addressing it according to their needs. And that's exactly what we are doing currently in the Western Cape. We still have lots to do in the Western Cape. No one's saying we don't have any more work to do. The fact of the matter is we've been able to now look back to see what we have in place and what we still need to have in place. This is why our organizations must be registered. There is no way that you cannot have registration because we need to work as a network so that they are able to apply for funding. We cannot provide funding if you are not registered with the Department of Social Development. And therefore, the City of Cape Town, for example, has got their own anti-drug unit as well, tackling these hotspot areas that we as a government has identified. So working from a supply reduction, working with strengthening families type of prevention, evidence-based programs. We also have our harm reduction teams that are working in the ground, but they cannot be reported on here in my report that I have because they're not being funded by DSD. So that's why partnerships then are critical, because then you can cover all of the areas that maybe not be seen here on these platforms, because the provincial dialogues was a communication from the community and our stakeholders. That was in our annual report that we reported on.
Thank you so much. My apology to cut you.
So I can give you all the information. If you come to me afterwards, we can share the information what we're doing in the Western Cape. Thank you.
All right, thank you. I think I would just want to please hand over to the CDA to close, to wrap up. And our suggestion is that in the commissions, all the PSF who are sitting here, if you can please address and answer some of the questions through that, because our online participants are really urging waiting. Thank you so much, panelists. In closure, CDA, please, Esco Chair. Thank you.
All right, thank you very much. We are all CDA here. And also, just to correct something, I'm not a minister. Somebody was calling me a minister. I'm not a minister. I'm a member of the CDA, Central Drug Authority. I'm happy that the Deputy Minister has joined us. Welcome, Deputy Minister. I would have liked, I think you will be talking, you will be sharing with us your views and ideas on this matter. You do have a podium tomorrow. A lot of questions have been asked, DM, and then I think you will be able, we will inform you, brief you, and you will be able to address the issues that have been asked. We just want to say that, I mean, we must welcome the Interministerial Committee. It's something that we have really been fighting for since we started as the CDA, and our role as the CDA is to hold our ministers who are responsible for this substance abuse situation accountable. It's goal number 5 of the National Drug Master Plan. We hold our political leaders accountable. We hold the DGs accountable. We hold everyone who is responsible accountable to implement the National Drug Master Plan. Because if we all can implement the National Drug Master Plan, we can be able to see a difference. There's a question on where the mayors are. I'm just answering questions around the importance of involvement of political heads. We have engaged with SALGA. There were induction programs at the beginning of the term of office of councillors, and we pleaded to SALGA that the mayors have a responsibility over establishing the local drug action committees, and also resource them, support them, give them a budget so that those LDECs can have teeth and they can bite. So we must also hold the executive mayors accountable. You yourselves must hold the mayors accountable where you are. If Mrs. James could write a letter to a president of this country and say the people are dying in our communities, the young people are dying, and the president responds, you can do the same. Write a letter to the mayor, write a letter to any political head that you have in your space, and demand those answers. So there is nothing that actually stops us from holding our political leaders accountable. The departments that you have mentioned are part of the CDA. the SANDAF, the SAPS, and I don't know which other department that you made mention of. They are part of us. They are part of the CDA, and they do a lot of work, and we are holding them accountable of what needs to be done. Of course, we have heard that some policemen, in most cases it's men, not women, are corrupt. And by the time the commissioner goes to go and confiscate the drugs, some police have already told the criminals, and somebody says, why do you call them drug lords? Let's call them criminals. They've already told the criminals that the commissioner is coming, and then they actually hide all the drugs. And by the time the commissioner arrives, the good police arrive, then the drugs are not there, and they're not able to arrest them. So let's also, take responsibility. I don't think pointing hands to each other is actually going to assist us. Let me just answer the very, very last issue around policy. I did say earlier on that social development has developed a policy so that they can actually amend the legislation. So you can't develop a law without a policy. I think we need to really teach each other, and we need to learn. So from that policy, I'm just mentioning one example of social development on prevention of and treatment of substance use disorder. We shall then be able to work with social development to ensure that we amend the law that is already there, to ensure that it actually complies with the international standards of United Nations, the principles that we always talk about of people-centered. Because if we don't involve people in the policies, in the laws that the country is making, we can never address the challenges that we have. The importance of community involvement, participation, the importance of multi-sectoral stakeholders, the importance of human rights. Again, the policies that the country develops must be based on human rights as well. And we are the people here in this room that can actually ensure that happens. We have already indicated that there's going to be an action plan from this summit, because we are not here to talk for the sake of talking. We have said there hasn't been a summit for the 10 years, but this CDA, the fourth CDA, we fought. You don't know how many fights we fought. We wouldn't be here. We had to fight to make sure that the summit happens, so that we hear from the people what people are saying, and that we are able, as you say, you want to review the National Drug Master Plan, to talk to all these principles, but we can only hear from you as to what is actually saying. So we want to commit that we will have that action plan or implementation plan, as you call it, and we will hold all of you, not only politicians, we'll also hold all of you as civil society accountable as to what did you do after the summit, because you can't attend the summit and go home and do nothing. But we do want to appreciate all the non-governmental organizations, all the departments that do a lot of work. The lazy ones we must deal with. We want to appreciate all those, yes, give yourselves a round of applause. We want to appreciate all the NGOs that are busy with harm reduction programs. I know that is not well accepted, but we really need to educate and make people understand that harm reduction saves lives. It saves lives. So we need to make each other understand that particular narrative, that it actually saves lives. So we are not going to answer each and every matter, but safe to say that we are really taking those laws head on. We ourselves as CDA, when we heard, it was started by the Mpumalanga chairperson, when we heard that there's a law that says there's going to be alcohol sold or in schools to raise funds by the education sector, we said no, we said a big no. And we wrote to the Department of Education, and we appreciate also the civil society who wrote, and after those engagements, that thing was scrapped. It was scrapped. And now we're busy with the liquor bill as well. And we have heard from the policy conference that there are good resolutions that have been taken. I can assure you that we're going to take up on those resolutions of the policy conference. We're going to make sure that the liquor bill is amended, and we're going to make sure that it's taken to Parliament, because it has been in the drawers, I don't know for how many years. So you need to make sure that the liquor bill addresses all the situations that you are talking about, advertising of alcohol, for young people to have a look at that, thinking that it's cool to abuse alcohol when it's not cool. Marijuana that is sold to the children, we need to deal with all those things, but there's alcohol and then there's also substance use as well. Thank you very much, program directors. We haven't exhausted all the all questions, not because we don't want to, but because we're going to commissions, we're going to breakaways. Please raise those questions sharply. Also hold us accountable. Hold us accountable as a Central Drug Authority. Thank you very much.
Thank you so much. Please, let's give our panelists a round of applause. Thank you so much for making sure that we get to answer each and every question. And again, it will be answered during the commission. May I please ask our panelists to step down, and if the chair of CDA can just please stay behind. Thank you. Tomorrow, so please be on the lookout for that. I would like to call my co-program director to wrap up so that we can break to the breakaway.
Yes, firstly, apologize to our online viewers for the delay, but yes, the room is getting real, and this is why we are here today. We're going to break into our various commissions right now, and I think our deputy chairperson, you've been working on this and making a few changes, so I'd just like for you to maybe just give us direction in terms of the rooms, where we'll be going, and where we'll be able to express most of the issues that we have brought to the front here today. Thank you.
Thank you very much, facilitators. Good morning, everyone. So we've got people that are waiting online. They've been waiting since 9:30. So yeah, we're really late. I will ask that when we step out of here, we'll go quickly and grab a cup of tea. And please take your tea and go to your the breakaway that you've decided to go to. So we're going to have 6 breakaways. They are already assigned. The breakaways are such. For goal 1, which is drug demand reduction, we are going to go to the Cape Town room. Let me just see. Okay, yeah. So goal 1 is Cape Town International. You can ask where Cape Town International is outside. There's people that are waiting to help us. Goal 2, which is drug supply reduction, is King Shaka. Goal 3, access to medicines, substances for medicinal use, NPS, yeah, that is in Lanseria. So that will be goal 3 and 4. Remember yesterday I said those 2 are combined in one room. And then goal 5, which is leadership, accountability, is in Virginia. Goal 6 is in Barcelona, research development. Goal 7, economic development, is Marco Polo. I will repeat. Goal 1, Cape Town International. Goal 2, supply reduction, King Shaka. Goal 3, Lanseria, 3 and 4, Lanseria. Goal 5, Virginia. Goal 6, Barcelona, and goal 7, Marco Polo. We are going to be outside as well. We can give you that, as well as our secretariat. And the way that we're going to do this is this way. You will be allowed to pick the goal you want to go to. We're not forcing you to go anywhere, but obviously if there's more people when you get to the room where you're going and you feel like you can actually go and contribute in another go or in another room, please do so. We are trying to just allow people to be in a room where they can contribute the most. And we do not want to be prescriptive to say you cannot go there, you can go there. No, you are free to choose a goal. It's similar to what we did when we went to the provincial dialogues, so you will be allowed to choose a goal. The facilitators, I'm asking all the facilitators, they know who they are, can they just remain in this room for just 5 minutes so that we can talk about how we're going to run this now that we have lost time. We need to buy time, so we will need to do a little bit of jiggling, and there is some kind of a solution that we have now. I will ask that we stand up and we immediately go and grab the tea and go to the room where you are deciding to go. There is a link. Anybody who needs the link to give to somebody, it's a Zoom link for anybody who would like to who would want to connect virtually. And when you go on the web app, you will see the goal